I'm Seth Forwood, Vice President of Programs for Fort Collins Rescue Mission here in Northern Colorado, and I'm joined with an old friend of mine, County Commissioner John Kefalas. We're going to have a discussion about homelessness and talk about issues that are important to both of our hearts.
Sure. May I introduce myself a little bit, just
Please.
to provide some context, and that is, yes, we have a friendship and we are colleagues on these issues. And certainly my current role is as an elected official is as a county commissioner, and prior to that I served in the legislature for 12 years. So I, from the perspective of policy and problem solving, sort of had that state perspective and certainly the on the ground local perspective of dealing with the issues that are often very complex.
Yeah, and we were able to share a classroom many years ago now, almost 10 years ago now, where you were my social work policy professor.
Yes.
Can you talk about policy and homelessness and how that all fits together for you?
Well, certainly. So it's important to determine, what is the issue that we're trying to address, what is the problem we're trying to address, and when it comes down to policy, what is the role of the public sector, what is the role of the private sector to try to address, stuff that's really complicated. So in the matter of homelessness and the lack of affordable housing, which is a big issue that contributes to oftentimes to why, why folks are homeless or why folks experience homelessness, it's important to understand all the factors that contribute to that. And what is the role of state government, what is the role of local government, and then how does that intersect with business community, residents, private sector. Faith communities, of course, have a critical role. And one of my heroes, of course, is Sister Mary Alice Murphy, who's been around for many years and is still with us and still shows up at events. She oftentimes talked about she gave the analogy of a stool, and a stool has three legs, and one of those is the public sector, the government, another one is faith communities, faith-based communities, and the third is private sector, and all of that encompasses.
Yeah. I mean, a recent win that I see with all three of those combining is the Larimer County behavioral health tax that was passed several years ago that has produced millions of dollars for mental health and behavioral health support, which tackles one of those issues about homelessness. I mean, you can't talk about homelessness without talking about mental illness. It's not the only issue, but that effort was really a partnership between government and private and public and faith.
Absolutely, and that's a very good example. And I mean, ultimately, the voters approved a sales and use tax initiative in 2018 that generates about $22 million a year. That helped us to build the acute care facility, the Longview campus. And in fact, it was really cool that on Friday, or a couple. When was it? A couple of days ago. When was that?
It was.
When were we out there?
It was Monday.
Yeah, Monday.
Yeah.
My goodness. As one gets older, one loses track of time.
Yeah.
But on Monday, you were there, and we it was a celebration of opening up the first adolescent unit.
That's right.
To serve I think 12 to 17-year-olds who are dealing with a mental health crisis. And prior to that, we couldn't do overnight because we weren't licensed for that. Now we are licensed for that, and we've opened up 5 beds, and young people who are experiencing crisis, who may be homeless, because we know that a lot of kids coming out of the foster care system are often dealing with those kinds of issues. But now they have a place to go for up to a week, and then transition to other services that they may need. But that's the voters approved it. It provides a dedicated funding stream. It helps with the acute care facility, but then perhaps just as important, it provides like $3 million in grants that go to community-based organizations, and that's spread throughout the county.
Yeah, which we have benefited from, to do a lot of our work. And it provided the first detox or
withdrawal management.
Withdrawal management, that's what we call it now, in Larimer County, which is such a huge resource and tackles another one of those issues in this multifaceted issue in the community called homelessness, which is substance use, right? And having having local withdrawal management is really helpful because you don't take somebody out of their community to address their issue. You can address their issue in the community and then get them right back on the path to housing quicker.
Absolutely. And in the past, before we had the detox center at the Longview campus, oftentimes law enforcement folks, if somebody was in a situation, they would have to take them out to the Greeley detox. And that's not the most humane way, that's not the most effective way. It's probably not the best use of law enforcement or county deputies.
It's not
time.
efficient,
No. And it's not, foremost, it's not good for the individual.
Yeah.
So I'm glad we have that resource.
Yeah.
Yep.
Well, and it took 3 tries to get that tax passed and for the voters to approve it. And there's a lot of work on a lot of areas to raise awareness around this issue.
So, it's interesting. I mean, I don't know, it's more philosophical, but the issue of homelessness has been with us for a long time. And if we go back historically, going back to the 80s, for example, some would offer that there was a significant increase in homelessness when the decisions were made at the federal level to folks who were in mental health institutions.
Yeah, psychiatric hospitals.
Psychiatric hospitals were released.
Yep.
And I think a lot of the advocates will say, and I agree, that they were released into the streets without proper community supports, without the resources.
Yeah.
And so I think things have kind of evolved since then, and I think different communities take different approaches. And I think here it's wise that you often talk about ending homelessness. It's not that simple, and I think what the approach that we take here is more reasonable and perhaps more achievable.
Yeah.
And maybe you could speak to that.
Well, our vision statement for our organization, part of it says we are striving to end homelessness, and yet we end with a really important phrase. It's one life at a time.
Yeah.
And I like holding both those in tension because we do strive. I mean, homelessness is a terrible thing for people to experience, and we want to be realistic about how we achieve that and marking success. And having one life be unshackled from homelessness is a huge success. And so that's how we kind of split that into achievable and realistic.
Yes, and thank you for reminding us that we're talking about lives.
Yeah, real people.
Oftentimes we talk about numbers, and we mustn't lose sight that we're actually talking about, whether it's elders or older adults, whether it's veterans, whether it's children or youth, and those are all lives that merit dignity and respect and support.
Yeah, well, one of the things I really appreciate about our relationship and being able to see you in a lot of different contexts is when you come and
that's
serve.
Good. I'm glad you appreciate our relationship.
When you come and serve meals, you always are able to find some time and actually talk with our guests. It is a personal experience for you and for them. And I'm wondering, in your decades of working in and around the field of homelessness, your job is much broader now, but I'm wondering what insights you've developed from these decades of working in homelessness and a little bit of that history.
Well, I think one thing is that it's important, especially if you're in elected office, to ground yourself in the realities, and that human connection thing is really important. So I actually really appreciate coming out to the rescue mission, either for Easter, for the holidays, Thanksgiving, of course, and it's an opportunity with real folks, to interact. And yes, speaking to people, although being mindful that sometimes people they don't want someone like me out of the blue in their space.
Yep.
And yet where you can find that safe space, I think it's very powerful.
Yeah.
So I always enjoy where I can be out in the community in different settings where those human connections can happen, and certainly volunteering there is a very very powerful thing, and it helps especially those of us who are elected. We spend too much time in front of our computers, and we forget who are the people we're actually serving. And for those of us who attempt to do this work as a commissioner, as a state legislator, we often are labeled as politicians, but I think it's an opportunity to serve as a public servant. And the more we can connect with real folks on the ground, I think the better. If I may, I'm reminded of a bit of a story. Would you like to hear a bit of a story?
Yeah, I'd love it.
It involves the Fort Collins Rescue Mission.
Yeah.
So I was walking along one of our streets here, Mason, and I had just gotten done with a meeting with our county engineer, some of the city engineers regarding roads and engineering stuff. And we were walking back to the county building where we are at the moment. And our county engineer was going into the garage. He was heading home, and I was coming back for evening meetings. And there was a fellow who was pulling along, one of those smaller suitcases.
Okay.
And it looked like he was having a very difficult time, and he looked a little bit disoriented. And I decided to approach this man, older man, and say, "Is there anything I can do to help?" And he would say, "Well, I'm trying." And this was in the wintertime, and so they had, apparently folks at the rescue mission had sent him to the cold weather shelter on Mason there.
Sure.
And then they said, "No, you got to go back to the rescue mission." So that was kind of unusual. But I said, "Yeah, I know exactly where it is. I'm happy to walk with you." And then I even convinced him to let me pull the little suitcase, although he really didn't want me to do that because he wanted to demonstrate that he could do it. So in the end, we managed to get across College Avenue, and he was limping of sorts, but he told me his story of, and it was pretty darn amazing.
Yeah.
And why he was, his take on why he was in this situation. And when we got to the mission door, that side door where you let folks in, the person who had the clipboard, I forget what his name is, I've met him before, he knew exactly this fellow. I think his name is Leonard or something. Anyway, and I said, "You really got to help this guy get in there." And he said, "No problem." He was on the list, and he got in there, and I guess he had a place to spend the night. Yeah.
Well, as you're talking about the multifaceted nature of this problem, I think where people go astray is when they reduce the story of this individual into one thing. It's really common to say that everyone experiencing homelessness is just addicted to drugs, right? And that's why they're on the streets. But when you start talking to people and you hear their stories, it is much more complex than just one thing, right?
Yes. Once again, a good point, good observation. And I guess that brings up, talking about, there are stereotypes, there are perceptions. And when I was growing up in New York, and I used to volunteer at places like the Mary House Catholic, the Catholic Worker House on East 3rd. And there's some of that history. And that kind of helped, that kind of helped shape things for me, I suppose. But there's that, there's that stereotype that it's men, it's older men, and they're, I think back in those days we called folks bums. Back in those days we called folks winos, and all of that. And it's much more, it's varied, and it's important for folks to know that there's different demographics, and one of the most tragic demographics, in my view, is families with kids. And when we talk about people experiencing poverty or living in poverty, you're a social work type, so you probably know these things. And that is, there's what's called situational poverty, and then of course there's generational poverty. And somebody who was middle class, perhaps, heck, they lose their job, the rent is so high, and all of those things happen, and they wind up, being homeless or living out of their car. And so I think it's important for folks to understand that. And the fact that a lot of kids are experiencing homelessness, children, families, and oftentimes these folks, people make mistakes, they get addicted. There are definitely serious mental health issues out there. But most of the time, from my experience, folks are playing by the rules, but sometimes the rules are not conducive to a level playing field,
Yep.
and you can be working your tail off
Yeah.
with 2 or 3 jobs, but you still can't, you still are paying half of your income for rent,
Yep.
and that can be pretty challenging.
Yeah.
So it's really important to help people understand that there's a lot of folks that are impacted by that,
Yeah.
by this, and it impacts us. Those of us who are privileged, who have a roof over our heads, it impacts us in so many ways. But I suppose that brings up a question that I said I might bring up, and that is, so how do we overcome that stereotype? How do we overcome that stigma?
Yeah.
And in particular, having been involved in this issue, for many, few decades, and people will say, well, you've been at it forever. How come
Yeah.
we still have homelessness? So how do you overcome the issue of if you build it, they will come?
Yeah.
And I have heard people say that when we build this state-of-the-art homeless resolution center,
Yeah.
finally got that right. And I've heard that folks from Denver might, be coming up here. So how do you
Yeah.
address those kinds of issues? You
Yeah.
know about this stuff.
Yeah, well, I get asked it a lot, the entire time of going through planning and zoning to get this approved. That was the question. Before I answer it, I want to highlight 2 things that I really appreciate you
I hope
saying.
these are good things.
They are good things. You bring up two other misconceptions. One is that everyone who's homeless is choosing to be homeless, right? And talking about kids, that's obviously, and talking about generational poverty, that's obviously not the case. You can see patterns, and you can see these kids that are handed the situation, they're handed the inheritance of homelessness and poverty. And then the second one is that anyone who is homeless is not working, right? And we see it all the time, as people are working their tails off, as you say. But inflation comes around, or rent, housing prices. Those are the factors that squeeze people who don't have the privilege that you and I might have into a homeless situation when they're really doing the best that they can. So I wanted to just highlight that. I really appreciate that perspective, and it needs to be said. But I'll answer your question. So, and I'll start by saying we call it a homeless resolution center not because it's hard to remember, but because shelter comes with some baggage to it. And when you only say shelter, I think a lot of people assume that you're giving them 3 hots and a cot, and you are just putting a Band-Aid on the situation. And this new building will have a 250-bed shelter inside of it, but it will also have resource spaces and day area spaces and lots of those things that actually serve to resolve homelessness and not just put a Band-Aid on homelessness. And homelessness has always been a part of Fort Collins and always been a part of the United States. And it may always be a part of our communities. So what do we do to address it, knowing that it's persistent? And my answer is, I think communities get a reputation for how they engage with this problem. And it's either to just go to the extremes. There's communities that want to police their way out of the problem, or make the community hostile to people experiencing homelessness so that they all go away. I don't think that works. And then there's communities who want to maybe just fund the problem. And I think that takes away some autonomy and empowerment from the people that are maybe experiencing homelessness. And those communities are more kind of harm reduction type communities, and so sometimes they decriminalize or allow safe spaces for drug use or drug sales and things like that. The Tenderloin District is kind of the prime example of that. And to thread the needle between those 2 extremes is what we're striving to do with this new Homeless Resolution Center. And that is you have to provide a safe place for people to be. And for that to be a truly safe place, it needs to be kind of low barrier, but high expectations for safety. And so we're going to continue operating a shelter that welcomes people who are intoxicated, but we're going to continue being very strict on not allowing any drugs or alcohol inside our building or any use of it. Because right now at Fort Collins Rescue Mission, we have men who have a history of addiction and have substance use disorder, but are maintaining their sobriety. And that's incredible.
So I'm wondering if we need to move this in the direction of some degree. I have a feeling the two of us could talk about this for some time, and I'm certainly open to that, but I wonder if we could shift a little bit perhaps and get into, what are we looking forward to? How do we feel like this new facility that where there's a groundbreaking, I think on September 26th.
Yeah, next Friday.
Is that next Friday?
Yeah,
Yes,
it is.
There you go again. I lose track of time. But how it will has the potential for making a significant difference because there still are a lot of folks walking around.
Yeah.
There still are issues with businesses or people who call us up at the county or call the sheriff's office and say, there's an RV camper.
Yeah.
It's been parked in front of my house for a week. Those kinds of issues. That's why this thing is really not a simple thing.
Yeah.
So maybe we could shift gears on the next year or so and how we're going to work together to
I love that.
Get the job done,
So to really wrap up, actually, because we're almost out of time, but to wrap up, this is an excellent thing to end on. Providing resources and providing responsibility are really the two hands that I think need to reach out into the community of people experiencing homelessness in order to give them hope that there's something more for them. And so having a safe shelter space gives people the ability to calm down enough from that survival mentality, even to imagine what being in a space of their own is. And then you need to have the resources put into the shelter, into that same building, in order for them to even utilize it. Because they've done studies where if resources for people experiencing homelessness are half a mile away even, the likelihood of engagement with those resources plummets because we just take for granted transportation. And I know you walk everywhere and bike everywhere as much as you can, right?
And occasionally I run.
And then running, yeah. But if it's all the way across town, then sometimes they can't get to it, and we can't assume that they have that. So, and then responsibility also. We want to call our guests to something higher because we see in them a dignity that they might not see themselves. And so providing the resources, giving them opportunities for responsibility, I think those are what we can do in a new, trauma-informed, designed building. That's also that factor. You brought up trauma earlier, which is so important that you need to pay attention to.
So may I share something on a positive?
Yeah, I'd love it.
Well, just that, I think we've come a long way with how we do our best to partner together. And I'm glad as one of 3 county commissioners, this issue of housing affordability, this issue of, what is the role of the county in addressing homelessness and mental illness and substance use disorder, substance abuse. I think especially with the current commissioners, this has been a really high priority. And I'm glad that when there was a time when there were federal dollars, American Rescue Plan Act dollars, that we were able to reinvest back in the community, that it, helps things like this homeless resolution center that we're talking about, and a variety of other things. We have learned a great deal that one of the best ways to address homelessness and a cost-effective and humane way is it's not rocket science, and that is to, quote, prevent homelessness.
Yeah.
So I'm glad that we had the resources for a time, and it's scaled back to help people with emergency rent assistance if they lost their job, and that sort of thing. So I think the partnerships are amazing. I think the county is very much, this is a high priority issue, is how do we deal with these things. And one thing that's coming up soon, in fact, we may receive a preliminary report, maybe you've seen it already, it's this effort that Homeward Alliance and some of the other players have been working on, this comprehensive regional approach homelessness strategy.
A strategic regional approach,
So we will have that very soon, and that will inform future decisions, future actions. So I think that's a really positive thing.
Yeah, I'm really looking forward to that. I think it'll provide a lot of direction and guidance.
And you've been engaged in that process, right? And we've provided input, and Aaliyah in our shop has been a wonderful facilitator of some of that.
Yeah. Well, John, thank you for joining me for this conversation.
Thank you, and hopefully you'll. I guess Thanksgiving is right around the corner, so I might get an email from you at some point.
Yeah, we'd love to have you come back.
Okay.
Yeah, take care.
Take care. Be well.